Hi, my name is Simran, Ghuman, and I will be presenting on after-school staff resilience during COVID-19 pandemic. I'd like to thank my co-authors for all their help with this project. So why after-school staff? After-school programming is an essential part of the community response to the coronavirus pandemic, especially in regard to building community resilience. As the pandemic has been progressing, program staff have been innovative in adapting their services to support youth, families, and communities in meeting unique and specific needs. We believe it is critical to develop resilience among after-school program staff to facilitate future re-engagement with youth and their families during the pandemic. Our aim, therefore, is to evaluate the current stress and resilience among elementary after-school staff related to the COVID-19 pandemic. Next, I'd like to discuss the setting for our community partner organization. It is an elementary after-school program within a large urban school district that consists of 199 school sites with more than 25,000 students. Approximately 2,000 staff are employed, consisting of predominantly young adults, ages 18 to 25 years old. With the onset of COVID-19, roles have changed from positive youth developer to working food distribution sites, testing sites, vaccination sites, student supervision, and virtual education enrichment. We are currently in the process of collecting data from an online needs assessment survey and plan to finish data collection on March 31st. Therefore, results outlined today in this presentation will be preliminary results only. Our primary outcome of interest is staff personal stress and resilience during COVID-19. On the left, I have a table of preliminary data that we're collecting. We do have some missing information for certain questions, which I've indicated next to that characteristic. First, I'd like to highlight age. On average, the participants who answer this survey are 31 years old with a range of 19 to 62 years. The average years worked in this program is 7 years. The majority of participants answered as program workers, which are staff designated to working with students in a classroom setting. Of those who answered the survey, the majority of participants identified as Hispanic, female, single, and not a parent or caretaker for one or more children. Most of our respondents reported that they currently have health insurance, and slightly over half reported working more than one job. Although these reported demographics aren't representative of a general population, they are fairly representative of our staff population. When asked the question, how much has COVID-19 changed these aspects of your life, participants responded using a Likert scale, with 1 being no change to 7 being extreme change. Only 10% of respondents reported no change in employment. The majority responded some change, with 24% expressing extreme change. Less than 40% of respondents reported no change in living arrangements, access to health care, and restrictions about shelter in place in their community, with the majority responding with changes in all of these categories. 16% of respondents reported no change in health of family members, with the majority reporting some change in health. Again, 24% expressed extreme change. I'd like to highlight that there's consistently a group of people who did express an extreme change in these parameters in the data collected thus far. When asked 2 questions about their bounce back and adaptability to assess resilience to the Connor-Davidson Resilience Scale, we found an average score of 6.39 out of a total score of 8. Nationally, the average score in the general U.S. population is approximately 6.91. If we look at the bottom right graph, we'll see the results of participant responses to the Short-Warwick-Edinburgh Mental Wellbeing Scale, which focuses on positive aspects of mental health and is an effective tool for monitoring mental well-being at a population level. We asked the participants 7 questions, and the highest score possible is a 35 on this scale. We'll see that 31% scored in the low mental well-being category, 56% in the average category, and 13% in the high mental well-being category. Endorsement of high resilience despite new changes and stressors demonstrates that our participants who responded are resilient, fulfilling, and comparable to what a general population would report prior to the pandemic. On this next slide, I've included some representative quotes from some of our pre-response questions in our survey. When asked about the top 3 stressors during the pandemic, one participant noted, "Isolation, work, and fear of loved ones dying are my biggest stressors right now." When asked about coping strategies for stress management, one participant stated, "I thankfully have my family and friends that I can vent to about how my day is or how I'm feeling. I also have been walking 3 miles daily to get my health back after long hauling effects from COVID. Lastly, I pray and I keep my faith strong that times will improve, and I'm grateful for having my job." When asked about recommendations for how the program can be more supportive, one participant noted, "I think the after-school program does a great job at checking in with us." Another participant noted, "Yes, but engaging with one another and checking in on one another." Implications. The infrastructure of elementary after-school programs in urban under-resourced communities supports well-being and resilience of staff and their community during a time of crisis. Strategies and recommendations collected from the survey will be used to guide wellness curriculum development to improve staff resilience. Results of this study may be used to inform future curriculum development for students and families once they re-engage with the after-school program. Thank you so much for your time.